Hello everyone, my name is Casey Glenn and I'm a student of ECPI University. This is my presentation called Shadowville's Rise of Hypertension for the NUR 444L course. I chose to focus on the rise of high blood pressure or hypertension in the scenario. Although the intended audience is more focused toward the adolescent age group, however, any age group can definitely take some learning concepts away from the provided material. I hope you all enjoy. When thinking of blood pressure, we first need to gain a concept of what makes up a blood pressure. You'll notice that there are two numbers in a blood pressure value. The top number is called the systolic, and the bottom number is the diastolic. The systolic value is the contraction or squeezing of the heart muscle, creating a heartbeat. The diastolic value resembles the relaxation of the heart between each heartbeat. A normal blood pressure reading is 120/80, or around that value. When the systolic and diastolic values begin to rise, then the blood pressure is also rising. There are 5 categories of blood pressure readings, and you can refer to the chart from the bottom up to the top. A normal blood pressure reading is a systolic of less than or equal to 120, with a diastolic of less than or equal to 80. An elevated blood pressure is a systolic of 120 up to 129, with a diastolic of less than or equal to 80. Stage 1 hypertension is a systolic reading of 130 up to 139, with a diastolic of 80 up to 89. Stage 2 hypertension has a systolic reading of greater than or equal to 140, with a diastolic of greater than or equal to 90. Hypertensive crisis is a systolic reading of 180 and a diastolic of greater than or equal to 120. As we think about different values that make up a blood pressure, you may question how or even what causes the blood pressure to go up. There are 2 categories of risk factors that contribute to blood pressure readings: non-modifiable and modifiable. In this slide, you'll see a list of what is all considered non-modifiable. If something is non-modifiable, this means that we cannot change it. For example, if I'm 30 years old, I cannot change the fact that I'm 30, despite how much I try to change up my skincare routine or wish to be younger, I will be 30. So with that in mind, genetics, DNA, age, race, or ethnicity, gender, and predisposing diseases such as diabetes mellitus or kidney disease, for example, cannot be modified. In the other category, modifiable risk factors are things that we can change. We have control over and we can change our dietary habits, alcohol consumption, smoking and or vaping, stress, obesity, and sedentary lifestyles. You may ask, how do risk factors affect blood pressure? Well, now that you ask, unhealthy lifestyle habits can lead to the accumulation of plaque in the arteries that cause narrowing of the vessels that blood passes through. This results in an increased pressure of blood up against the arterial walls, creating high blood pressure values. Over time, if no changes are done to fight against the higher blood pressure readings, then this will cause damage to the arterial walls and making an individual more susceptible to heart attacks and strokes as a result of the untreated hypertension. High blood pressure can be prevented or managed through the act of lifestyle modifications. Dietary changes can help lower high blood pressure. An ideal diet would be the DASH diet. It incorporates whole grains, vegetables, and fruits with minimizing or eliminated saturated and trans fats. The DASH diet encourages you to maintain an intake of 2,000 calories or less per day, as well as maintaining an intake of 2,300 milligrams or less of sodium per day, which is your salt intake. It's key to also take into account the amount of cholesterol and sugar you consume. Next is exercising, and don't panic, you don't have to go out and run a bunch of marathons. However, it's important to get at least 30 minutes of physical exercise per day. Whether you participate in a sport or you just go outside and take a walk in the park or even your backyard, that 30 minutes of exercise can help regulate a healthy blood pressure. With the physical exercise, you should take note of your current weight, and if you notice that you need to lose a little bit of weight, just a few pounds, then you can take this opportunity to do a combination of better dietary habits and exercising in order to meet and maintain your goal weight. Another way to reduce high blood pressure is to decrease the amount of stress you may be experiencing, and this is easier said than done, especially when you have school and sports, work, and the stressors of life obligations in general. This may be a challenge to achieve. To reduce stress, try to minimize or eliminate as many stressors as you can, or at least don't handle them all at once. Try to handle them in moderation. Another way to decrease stress is to make sure you're getting enough sleep with an average of 8 hours per night at best. Yes, and this means that you should not be sitting up all hours of the night playing video games. Participating in smoking and or vaping cessation. Smoking negatively impacts your arteries, heart, and lungs. With the effect of the smoked and or vapors, it does increase your blood pressure related to the stress on those vital organs. To be proactive in knowing what your blood pressure is, you can attend routine blood pressure screenings and also follow up with your healthcare provider for routine checkups. And if your physician prescribes you blood pressure medications at any time throughout your lifespan, you should take them as prescribed. All references that were used for this PowerPoint presentation are listed in this slide. In the comment section below, I have attached a trifold brochure that simplifies the PowerPoint. The brochure may be printed off, two-sided, folded, and used to help you in the future if you are considering making better choices for your blood pressure. Risk factors and lifestyle modifications, and even blood pressure value chart is included in this brochure. Also, if you want to test your knowledge, I did also provide a 5-question quiz. So please feel free and take advantage of these resources. Thank you so much for your time.